Hello all, welcome back to the Nursing Genre YouTube channel. At the moment, I'm going to explain a condition called congestive heart failure, which is an important topic in adult health nursing or medical surgical nursing. Let's get into the topic. First of all, definition. Congestive heart failure or heart failure is a long-term condition in which your heart can't pump blood well enough to meet your body's needs. That means if we have congestive heart failure, our heart cannot pump enough blood to fulfill our body needs. Risk factors. Let's see who is at greater risk of getting this condition. First one, being older than 65, using tobacco products, cocaine or alcohol, having an inactive lifestyle, eating foods that have a lot of salt and fat, having high blood pressure, having coronary artery disease, having a heart attack or MI, having a family history of congestive heart failure. Causes. What causes congestive heart failure? Maybe coronary artery disease or a heart attack, cardiomyopathies, whether genetic or viral, heart issues present at birth, that means congenital heart diseases, diabetes, high blood pressure, arrhythmias, kidney diseases, a body mass index higher than 30. Now let's see the clinical manifestations of this condition. First one, shortness of breath, waking up short of breath at night, chest pain, heart palpitations, fatigue when you are active, swelling in your ankles, legs and abdomen, weight gain, need to urinate while resting at night, a dry hacking cough, a full or hard stomach, that means a bloated stomach, stomach bloating, loss of appetite or upset stomach, that means you are having a nausea and all. How can doctors diagnose this condition as congestive heart failure? So by using the following tests, they can diagnose the congestive heart failure. First one, they order some blood tests, cardiac catheterization, chest x-ray, echocardiogram, heart MI, that means magnetic resonance imaging, cardiac computed tomography, CT scan, electrocardiogram or ECG, multizated acquisition scan, MUGA scan, stress test, genetic testing. So they'll run these and all tests to diagnose the congestive heart failure. How to treat a patient with this condition called congestive heart failure? Some common types of medicines used to treat heart failure are angiotensin converting enzyme ACE inhibitors. So what they'll do, they'll relax blood vessels. Next one, beta blockers. This slows the heart rate. Angiotensin receptor neprilysin inhibitors. So they'll do open up arteries and improves the blood flow. Digoxin. So it will strengthen the heartbeat and help our heart to pump more blood. Diuretics and aldosterone antagonists. So they'll do extra. That means they'll do work that makes the body to quit or to get rid of extra fluids and others. This is about the medical management. What if those treatments don't work? You may need one of these procedures. That means these are all surgical procedures. Coronary bypass surgery to route blood around a blocked artery, heart valve repair or replacement, implantable cardioverter defibrillator to put your heart back into a normal rhythm if it goes out of rhythm. Cardiac resynchronization therapy, also called a biventricular pacemaker, ventricular assist device. A heart transplant is an option for people with very severe heart failure who haven't improved with surgery or medicine. This is about the surgical management. Finally, how healthy people can prevent this condition. So through prevention, how can we prevent? Staying at a weight that is healthy for you. That means you have to calculate your BMI, body mass index, eating foods that are good for your heart, exercising regularly, managing your stress, stopping the use of tobacco products, not drinking alcohol and alcohol related drinks, not using recreational drugs, Taking care of other medical conditions you have that can increase your risk, like high blood pressure or hypertension and all. And what if congestive heart failure worsens? We can see these complications like irregular heartbeat, sudden cardiac arrest, heart valve problems, a collection of fluid in your lungs, pulmonary hypertension, kidney damage, liver damage, and finally malnutrition. So, this is about the condition called congestive heart failure. We have seen definition, risk factors, causes, clinical features, diagnosis, management, surgical management, and prevention, complications of this condition. So, thanks for watching this video. If you find this video helpful for your study, do like, share, and subscribe to this channel, The Nursing Genre. Thank you.